We have not taken this decision lightly. We agonized over it, actually, but we just must do this at this time. Similar to what's happening in the community, we have to protect our patients, many of whom, the majority of whom are vulnerable with chronic diseases, etc. We have to protect them from anything coming from the outside in this time of this pandemic. So similar to the social distancing that's happening, we're protecting these patients, and we must do it. If you look at the global news, it's happening all around the world to a further extent than we have. So that's the main reason, is to protect our vulnerable population. But we also must also conserve our protective equipment that we have for staff to care for these patients. We don't know how long this is going to go on, and we have to make sure that we have the gowns and gloves and masks in particular to care for these patients as they become ill and as we begin to get patients in. So another thing that visitors do is consume the use of that type of equipment as well. So it's twofold. Our primary priority, our top priority, is to protect this vulnerable population, and we also want to conserve our protective equipment. We know that visitors are part of the healing process for patients as well. We, like the rest of the community, also have relatives in hospital now, and it's difficult not being able to see them. So we're asking people to, if you can bring in a mobile device, laptop, make sure they have a phone to keep that contact, and then the contact becomes physical distancing versus social distancing. We will be happy to take your calls, to go into patients and assist them being able to reach out and talk to you during this time.